So welcome everyone, and thanks a lot for joining us today. Today we're going to be presenting on our work looking at families' experiences of inadequate housing in Ireland. So this is work undertaken by my co-authors and I, Helen Russell and Emma Smith, and was funded by the Department of Children, Equality, Disability, Integration and Youth through a joint research partnership with the ESRI. And I would just like to acknowledge the department's commitment to the programme. So by way of introduction, it's important to say that home is really more than just a place of shelter. It's the centre and the core of family life, and it is also a key site in children's development, especially during the early and middle periods of their childhood. So there's a large international literature on the impact of poor housing on children's outcomes and the outcomes of their families. So this evidence is particularly strong on the impacts of physical housing quality on children's health outcomes. But there's also a small but relatively consistent set of studies which have shown that there are negative effects of poor neighbourhood environment for children's educational or social and emotional outcomes as well. Studies have also found that residential mobility in childhood can be associated with emotional behavioural problems and also poorer educational outcomes as well. But then these findings do tend to vary by age of the child or the frequency of moves and also the wider context in which the moves take place. But in spite of this, there's actually been relatively little research into these questions in the Irish context. And the Irish context in particular is quite interesting, given traditionally, at least, it's had a relatively high level of home ownership and also relatively low levels of residential mobility as well. So just to begin with some of the housing contexts of the families studied in this project. The study followed a cohort of children born in 2008, 2007, around about the time of the housing crash. And this was followed by a period of prolonged recession and very low levels of investment in social housing. So alongside this, Ireland has also been experiencing wider shifts in housing trends over the last few decades. There's been an ongoing decline in home ownership from a peak of 80% of households in 1991 to around 68% in 2016. That was the time of the last census. This has occurred alongside a sharp rise in private renting, which has occurred recently. And this has grown from around 10% to 19% of households in the private rental sector between 2006 and 2016. At the same time, there have been wider issues of housing affordability, which have continued to be a significant concern in Ireland. This has been especially acute in the private rental sector in recent years. And as we'll see later on, these kinds of trends have likely played a key role in families' experiences of housing inadequacy. So to explore families' experiences of housing inadequacy, the study drew on the Growing Up in Ireland 2008 cohort data. This is a representative sample of children and caregivers who turned 9 months old in 2008. So our study used 4 waves of data from the Growing Up in Ireland study. When children were 9 months old, 2008, 3 years old in 2010 to 2011, 5 years old when they were in 2013 to 2014, and when they were 9 years old in 2017 to 2018. So this data follows the lives of these children over time. And because of this, it offers a unique opportunity, really, to study families' experiences of inadequate housing and its implications for children's development over their early and middle childhood. However, it's important to say that the data does have several potential limitations for our aims. Although they're not entirely absent from the data, there is an underrepresentation of the traveller community, as well as those families in direct provision. Importantly, the data do not contain those families directly experiencing homelessness. So there is some hidden homelessness, likely families in the data, These might be families who are living with a child's grandparents, but we don't capture those directly experiencing homelessness. And lastly, that families with more unstable housing trajectories, who are more likely to be moving a lot, are often more likely to drop out of data of this type as well. But it's very likely that these families themselves are experiencing particularly harsh housing conditions and inadequate housing experiences. So because of that, the estimates in this study are likely to be conservative when it comes to the levels of people experiencing housing inadequacy. So to measure families' experiences of inadequate housing, we developed a multi-dimensional indicator which sought to better capture people's broader experiences of housing. We therefore consider not only the conditions of families' homes, but also the conditions of their wider neighbourhoods as well, which, as mentioned, research has shown can be important for children's development. In addition, we also consider families' experiences of residential mobility too. As discussed, prior work has shown that moving house can be extremely stressful for families and can have a negative impact on children's lives, not least by uprooting them from schools and neighbourhoods they are familiar with. However, house moves can also be linked to things like better schools, safer neighbourhoods, and more pleasant living environments, all things that may be positive for children's development as well. So therefore, how residential mobility affects children and families may depend on the reasons for moving and where they end up. In the following slides, we outline in more detail the measures of housing inadequacy we apply in the study. So firstly, regarding people's homes, we capture people's type of tenancy. That's whether they're in owned homes or private renting, social rented sector, or if they're living with their child's grandparents. We also capture their subjective opinions on whether their accommodation is suitable for their family's needs, and if not, why. So this includes things like whether they think the accommodation is too small and cramped, whether the accommodation is child friendly, or whether there are poor conditions in the home, such as damp or leaks. We also measure whether households struggle to keep their homes warm, and this helps capture experiences of fuel poverty amongst families. To capture the conditions of the neighbourhoods in which families live, we use a measure based on parents' own reports on the levels of physical problems and social problems in their neighbourhoods. So this includes how common parents believe it is to find rubbish and litter lying around, that homes and gardens are in a bad condition, that there is vandalism and deliberate damage to property, and there are people being drunk or taking drugs in public. So where parents report such signs are fairly common or very common, they're considered to view their neighbourhoods as having higher disorder. Lastly, as mentioned, we also measure children's experiences of residential mobility in early and middle childhood, so between the ages of 9 months to 9 years old. So just to briefly mention some of the methods we use. When we're exploring what kinds of parental and household characteristics predict families' levels of inadequate housing, or what experiences of inadequate housing have on children's health and social, emotional, and cognitive development outcomes, we apply a technique called multiple regression modeling. So essentially, these kinds of models, they allow us to test which factors are the most important for housing adequacy, and also to account for families' backgrounds and the household backgrounds when we're studying the effects of housing inadequacy on children's lives. So one key point to note, though, is that this study follows the same set of families of children who were born in 2007 to 2008 over time, so over their lives up to around 2017, 2018. What the data doesn't do is provide a snapshot of levels of housing inadequacy amongst all families in Ireland at multiple points in time. So as mentioned, alongside the aim of the study to look at families' experiences of inadequate housing, this study also aimed to look at what the impacts of growing up in inadequate housing are for children's health and developmental outcomes at age 9. So in the following slide, we outline the key child outcomes that we use in the study. So to capture children's social and emotional development, we use the Strengths and Difficulties Total Score. So this captures peer relationship problems, hyperactivity and inattention, conduct problems, and also emotional symptoms like anxiety. We also capture children's ability to relate well with their peers and how far they favour actions that benefit the individuals with whom they live. And this is captured using the pro-social behaviour component of the Strengths and Difficulties instrument. We also look at the cognitive development of young people, of children, and this is measured using their Drum-Condra reading test score at age 9. So in terms of children's health, we measure how many separate episodes, bouts of respiratory problems the child had in the past 12 months, and this captures elements of respiratory problems that they might experience. We also measure the number of accidents for which a child has had to seek medical attention. And lastly, we use a measure of parents' self-rated health of their child, so how healthy a parent believes their child is. So we turn now to some of the findings of the study, and we begin by looking at families' experiences of inadequate housing in Ireland. So we begin by looking at some of the types of tenancies that families are living in. And this was when their child was 9 months old in wave 1 of the data, and at 9 years old in wave 5 of the data. So as you can see, the majority are in owner-occupied homes, but around 25% in both periods are not. And also in both periods, between 11 and 14% are in private rented accommodation. Importantly, at the aggregate level, as we can see, there's also relative stability in families' housing tenure during the first 9 years of a child's life. And we can observe that a similar proportion are in each type of tenancy in both time periods. However, some families do change between different types of tenancy over time, yet still 82% of families were in the same type of tenancy when their child was age 9 years old as when the child was age 9 months old. Again, just to note, we don't see the recent uptick in people in private rented accommodation that we've observed nationally, national statistics, because we're here following the same families over time. So any of these changes are primarily down to life cycle effects. These findings raise the question then of what kinds of families tend to be found in different kinds of tenancies. So looking at the characteristics of families when children were 9 years old, we find that household composition is one of the strongest predictors of the type of tenancy in which a family is living. So we see that lone parents are 4 to 5 times more likely to be in socially rented or private rented accommodation compared to owning their own home. Although one-child lone parent households were more likely to be in private renting and 2+ child lone parent households in socially rented housing. We also see that lone parents are more likely to be living with their parents as well, so with the grandparents of the child. Now, importantly, these greater risk factors hold even after we're controlling for the socioeconomic status, such as employment levels or income of the household as well. Another factor is that where families where parents do not have Irish citizenship are also more likely to be in rented accommodation, especially private rented accommodation. So for example, families where neither parent has Irish citizenship are 5 times more likely to be in private rentals compared to owning a home. Parents with disabilities were also more likely to be in private rented accommodation as well as social rented accommodation. And unsurprisingly, households where parents were unemployed or economically inactive, had lower qualifications, and especially lower incomes were also much more likely to be in rented properties than to be homeowners. We now turn to looking at families' perceptions of housing suitability. Now, the first 2 columns of this figure show the proportion who believe their accommodation is unsuitable. And overall, around 1 in 10 children were living in unsuitable accommodation, and this increased slightly over their childhood. The next columns in the figure look at the main reasons families believed their accommodation was not suitable. As we can see, the main reason is that families believed their accommodation was too small and cramped conditions, but smaller proportions reported it was unsuitable due to it being not child-friendly, or if it was having poor conditions such as damps or leaks. This figure looks at the proportion of families who reported struggling to adequately warm their home, which is a useful indicator of fuel poverty. So here we find that between 7 to 8% of families were living in homes that they were struggling to heat, with this proportion shrinking over time by about 1 percentage point. This slight decline over childhood likely reflects the improvement in families' financial situations between 2008 at the onset of the recession, at wave 1 of the data, and 2017 to 18 when the recession had largely abated in wave 5 of the data. However, this figure will have likely shifted significantly in the last year given the substantial rise in energy costs. Lastly, this figure looks at the levels of social and physical disorder reported by parents in families' neighbourhoods. So here we see that close to 20% of families report higher levels of disorder in their neighbourhoods, and that this value changed very little between when the child was 9 months old to 9 years old. So we next turn to looking at whether some children might actually spend prolonged periods of their childhood living in inadequate housing. So this chart looks at the proportion of children who experience persistent inadequate housing over their childhood from the ages of 9 months to 9 years old. To look at this, we looked at each of the 4 surveys of the GUI data that we used, and we counted the number of surveys in which children had been living in inadequate housing at the time of the survey. And so this gives us a measure of the frequency of exposure to inadequate housing conditions. And we can see that for some children, worse housing conditions were a persistent problem over their childhood. For example, nearly 7% of children spent persistent periods in homes that the household could not afford to keep warm. A similar proportion spent much of their childhood in housing that was too small, and around 16% spent persistent periods of their childhood living in neighbourhoods with higher levels of disorder. So, what kinds of families are more likely to be found in inadequate housing? To explore this, we modelled how the characteristics of families when children were 9 years old predicted each indicator of housing inadequacy that we used in our study. So we see, as expected, lower socioeconomic status families are much more likely to live in inadequate housing, such as households where one or both parents are unemployed or inactive, or where mothers have lower qualifications. Lower income households are at particular risk, being more likely to report their homes are unsuitable, to struggle to heat their homes, and to report that the neighbourhoods they live in contain higher levels of disorder. Lone parent households are also at greater risk of living in inadequate housing. Part of this is related to their socioeconomic profile, particularly their household income. Yet even after we account for this, lone parent households are still more likely to be in inadequate housing. For example, lone parent households are between 2 to 4 times more likely to be in unsuitable accommodation compared to homeowners. Families where parents have a disability are more likely to experience various forms of housing inadequacy, but also the types of tenancies in which families live is a key predictor of whether they're living in inadequate housing or not. And problems of inadequate housing quality are more common amongst those living in the private rented and social rented sectors. So for example, families in socially rented tenancies compared to homeowners are more likely to report living in disorderly areas and to be unable to adequately heat their homes. In fact, they are 3 times more likely to report their housing is unsuitable compared to homeowners. Families in privately rented accommodation are also twice as likely to report unsuitable accommodation than homeowners, and over twice as likely to struggle to heat their homes. So the type of housing tenancy people are in explains some, but not all, of why different groups are more likely to experience inadequate housing. For example, part of why families with lower household incomes or lone parent families are more likely to experience inadequate housing is because they're actually more likely to live in rental accommodation. However, most of these effects of families' backgrounds still persist even after we control for the tenancies in which they live. Lastly, inadequate housing is also more common in urban compared to rural areas. For example, residents of urban areas are nearly 2.5 times more likely to report living in unsuitable accommodation. We next turn to look at families' experiences of residential mobility in Ireland. So in the study, we find a relatively large minority of children, nearly 30%, experience moving house at least once between the ages of 9 months and 9 years old. Some children are actually much more likely to experience moving house in early and middle childhood than others, even after we account for their socio-economic backgrounds. So children born into households where one or both parents had a limiting long-term illness were more likely to experience moving in childhood, while children born to parents who are non-Irish citizens were also more likely to move house. In fact, where both parents were non-Irish citizens, they were nearly 3 times more likely to move house than families where both parents were Irish citizens. Children born in towns and cities were also more likely to move house than those born in rural areas. And one key factor that came out of the analysis was that family dissolution, but also family formation, are key drivers of residential mobility. So compared to stable 2-parent families, we find lone parents who remain without a partner in their household over time are twice as likely to move house. Children in families who go from being a 2-parent household to a lone parent household are actually 5 times more likely to move house. However, interestingly, families that go from being lone parent households to 2-parent households are also more than 5 times more likely to experience moving house. We also find that the type of housing tenancy that children are born into is also a strong predictor of moving house during early and middle childhood. So compared to being born into an owned home, children born into socially rented housing are 3 times more likely to have experienced moving house over their childhood, whereas children born into private renting housing are around 7.5 times more likely to have experienced moving house during their childhood. And given children in private rented accommodation are much more likely to move house than those in socially rented accommodation, this shows that socially rented accommodation tends to afford a somewhat greater degree of stability, although it still remains more than those in home-owned accommodation. Lastly, children born living into households living with their grandparents are 5 times more likely to move house during their early and middle childhood. Another factor is family socioeconomic status. However, interestingly, this has mixed effects on their residential mobility. On one hand, children born into families where parents are unemployed, they're more likely to move during childhood, while households with lower incomes are also generally more likely to move. These effects of greater residential mobility amongst lower socioeconomic status groups tend to be driven by the fact that these families are often more likely to be in rented accommodation. However, interestingly, on the other hand, children of more educated mothers are also actually more likely to move house than children of mothers with lower education. At the same time, households experiencing an increase in their household income over time are also more likely to move house compared to families whose household incomes remain low over time. Moving house is therefore likely something that families may be forced to do due to limited opportunities and resources, but it's also something families will likely choose to do due to improve their situations due to the availability of resources when they can. So finally, we'll move on to talking about how inadequate housing shapes children's health and social, emotional, and cognitive development. We first turn to look at what implications growing up in inadequate housing has for children's health and developmental outcomes. To do this, we again looked at the number of times between the ages of 9 months and 9 years old when children had been in inadequate housing to measure a child's frequency of exposure to inadequate housing conditions during their childhood. We then looked at how this related to their outcomes at age 9 after accounting for things like their socioeconomic background or parental health. So looking first at children's health, the most consistent driver of poor health outcomes amongst 9-year-olds is homes where the household struggled to keep the home warm. Among children who spent more time growing up in homes which the household struggled to warm, parents were more likely to report their child had respiratory problems, that they experienced more accidents requiring medical attention, and to report that their child had worse health at age 9. Crucially, this remains the case even when we're controlling for things like household income, education, disability status, or lone parent status of the household. Respiratory problems were also more common amongst children who spent more of their childhood in accommodation with poor conditions, such as homes with damp, drafts, or leaks, than their peers who did not. Children who spent more of their childhood growing up in neighbourhoods that their parents felt had higher levels of disorder were also more likely to have experienced more accidents that required medical attention at age 9. We next look at how experiences of inadequate housing affect children's social, emotional, and cognitive development. So here we look at children's social and emotional development, as well as their ability to relate well with their peers. We again find that longer exposure to inadequate housing is related to poorer developmental outcomes amongst children at age 9. Those children who spent more time growing up in homes that were too small, where the household struggled to keep the home warm, and where parents believed the neighbourhood had high levels of disorder, were more likely to exhibit social and emotional difficulties at age 9 compared to their peers. So this is things like behavioural problems or greater levels of anxiety. At the same time, children who spent more time growing up in accommodation that was not child-friendly and in more disorderly neighbourhoods were also more likely to have difficulties relating to their peers, exhibiting fewer prosocial behaviours at age 9 compared to their peers. The types of tenancy in which children grow up also matters for their developmental outcomes. So compared to children who spent more time growing up in homes that were owned, those who spent more time growing up in private rented accommodation had more difficulties relating to their peers at age 9. Those who spent more time living with their grandparents also had more difficulty relating to peers and had lower reading test scores at age 9. And more time growing up in socially rented homes led to more social and emotional difficulties, more difficulties relating to peers, and these children had lower reading test scores at age 9 as well. However, it is important to note that the association between tenure, for example, social housing status, and children's outcomes may not be solely driven by being in social housing. For example, the negative association between social housing and reading scores may reflect a greater concentration of disadvantage in the neighbourhoods that the children live in or in the schools that they attend. We also found that moving house between the ages of 5 and 9 can also affect children's social and emotional development. However, interestingly, its impact depends on their family's socioeconomic background. So, children from families in the lowest quintile of household incomes who moved house reported much higher levels of social and emotional difficulties than their equally disadvantaged peers who did not move. However, children from more advantaged families in the highest household income quintile actually see lower levels of social and emotional difficulties compared to their equally advantaged peers who did not move. So potentially moving house among more disadvantaged families may be less a matter of choice and more a matter of need. For example, a temporary tenancy ending or being unable to afford a home. This may result in greater disruption of children's lives, greater stress amongst parents, or moves to poorer housing and schooling, which harms children's social and emotional development. However, moving house among more advantaged families may be more associated with an improvement in circumstances, such as moves to nicer areas with more facilities, nicer home, better environments, or better schools, all things which may actually lead to an improvement in those children's social and emotional development. So we'll now move on to just summarizing some of the key messages that came from this report. So we see that the majority of children in Ireland do tend to be growing up in relatively adequate housing conditions. However, we also find that a significant minority do experience poorer housing conditions. And at the aggregate level, at least, the proportion that changed was very little over these children's childhoods. In particular, we find that some children experience persistently worse housing conditions throughout their early and middle childhood. We also see that certain types of families are much more likely to experience worse housing outcomes. So this includes lone parents, lower socioeconomic status families, parents with disabilities, but we also find that tenancy appears to play a key role, particularly those living in socially and rented accommodation compared to owned homes, and that's often linked with worse housing adequacy conditions. So furthermore, we found that moving house is relatively common amongst children during their childhood, between the ages of 9 months and 9 years old, and around 30% did experience at least one move. However, we also see that some groups are much more likely to experience it than others. So especially lone parents, families which dissolve, but also new families which form. And in particular, those in rented, especially private accommodation, are much more likely to move. So children living in inadequate housing, what do we find? We find that those in inadequate housing and in more disorderly neighborhoods have much worse health and developmental outcomes at 9 years old compared to their peers. And in particular, what's striking is that the longer children are exposed to inadequate housing during childhood, the more harm they appear to experience. And importantly, these effects of housing adequacy on their outcomes matter even after we account for things like their socioeconomic background, their family type, and their parents' health and such. Now, given social, cognitive, and emotional problems at an early age and early periods of ill health can have lasting effects on children's lives, these findings are especially important. They suggest that inadequate housing may leave a lasting scar on children's lives in the future. So this study raises several important implications for policy. So currently there's a very strong policy focus on housing supply and affordability, but there also needs to be an equal focus on issues of housing quality as well. So lack of heating and damp housing, as we saw, have a key detrimental impact on children's health. So targeted supports to address current fuel poverty among families will have long-term benefits for children. Multiple house moves, as we saw, have a negative effect on child development in low-income households. And this points to the importance of housing security and improving that, especially within the private rental sector. The results also suggest the need to monitor and maintain high housing standards in the private rented and social rented sector. But more could also be done to improving the physical and social infrastructure of neighborhoods. And this will pay dividends in terms of child health and development later in lives, especially in areas with social housing. And people with disabilities and lone parent families, the results find that additional supports for these groups can help to ensure housing adequacy. And one way of addressing issues arising from disorderly neighbourhoods is via funding DESH schools. And this is a key pathway through which children can have their education and socio and emotional outcomes improved, and especially for those children in these disadvantaged areas. So thank you all for listening, and if you have any further questions or queries, please don't hesitate to get in touch with us. Thank you.